Support for this podcast and the following message come from Allianz Travel Insurance. Sometimes exploring the unknown gets a little too unpredictable. When your travels get off track, protection against delays, interruptions, and cancellations can help. Learn more at AllianzTravelInsurance.com.
Hello, hello. I'm Brittany Luce, and you're listening to It's Been a Minute from NPR, a show about what's going on in culture and why it doesn't happen by accident.
"29-year-old males sitting on their couches playing video games. We're going to find those guys and we're going to send them back to work."
This week, we're connecting the dots between the doctor's office, a welfare check, and your mom's couch. I know. How are all of these things connected? We're going to find out with Joan Alker, Executive Director and co-founder of the Georgetown Center for Children and Families, and Jamila Michener, Professor and author of Fragmented Democracy, Medicaid, Federalism, and Unequal Politics. Jamila, Joan, welcome to It's Been a Minute.
Happy to be here.
Hello.
Thank you for joining me today to talk about something that affects all Americans, whether they know it or not. All week long, the House and Senate negotiated a huge spending and tax bill, one that includes deep cuts to Medicaid, the program that provides insurance to about 83 million low-income people in the United States. The bill passed on Thursday. Now, there are critiques of Medicaid, that it's hard to navigate, and many people feel like they have to jump through all kinds of hoops just to stay covered. But why would a program that insures 1 in 5 Americans and nearly half of the nation's children end up on the chopping block in the first place? How did we get here? Jamila, of all the things to possibly cut, why Medicaid? What made it a desirable target?
I think the thing that makes Medicaid the biggest target as far as cuts is just how expensive of a program Medicaid is, right? So if you want to redirect a whole bunch of money away from low-income people and towards upper-income people, there are actually only a few places to look where you can find hundreds of billions of dollars. And if there are certain things that are off the table, right, like you're not willing to spend less on defense, you're not willing to invest less in immigration enforcement and detention, you take some of the other places that we're spending tons and tons of money off the table as options, then really what you have left in terms of heavy-hitting, big spending programs, Medicaid is near the top of that list. It's an incredibly expensive program. And of all the expensive programs one could cut, Medicaid serves a relatively vulnerable population. And so you might think you could get away with it, too.
I see what you're saying. So it's expensive. And additionally, it covers people who may not have the monetary or political resources to organize and push back on that. And therefore, that might make it an attractive cut. What's the stereotype of people on Medicaid, and how does that differ from the reality of who's actually on Medicaid?
Yeah. One thing that always strikes me about stereotypes around Medicaid beneficiaries is that everybody has them. And I've spent over a dozen years essentially in prolonged research-based conversations with people who are themselves on Medicaid. One of the questions that I've asked in some of these interviews is, when you think about the average Medicaid beneficiary, what are they like, and are they similar to you? And most people will say, no. I'm hardworking. I am trying my best. I'm just in a hard situation right now. I have this chronic illness. I lost my job, et cetera, et cetera. And the idea is, well, there's this stereotypical, frankly, fictional Medicaid beneficiary who's just sitting around loafing, living off the government because they don't want to work, right? And the reason why so many people say not me is because that fictional Medicaid beneficiary is actually a figment of the public imagination for the most part. There's a set of people it serves to paint Medicaid beneficiaries as loafers and takers, people who need to be surveilled, people who need to be watched and treated punitively.
Gosh.
I completely agree. These stereotypes go back to the Elizabethan poor laws many centuries ago in England. And it serves the purpose well of those right now, and this is not new, who have a lot and they don't want the government to be taxing them. We've seen this at the state level and the federal level now for many years. Medicaid is expensive in the sense that it is the largest amount of dollars that the federal government spends on poor people. And I've noticed over the past 20, 25 years that I've been working on Medicaid is that you can go into focus groups where Republican voters don't want cuts to Medicaid, same as independent voters and Democrats. You cannot access health care in this country unless you have a lot of money or you have to have health insurance. It's the price of admission to our healthcare system. So defining Medicaid as health insurance is key to how we think about this issue, as opposed to defining it as welfare, which leads you exactly into what Jamila is talking about.
That's an interesting distinction there. It actually makes me think about a key aspect of, the cuts that people have been proposing recently. We've heard a lot about proposed work requirements for able-bodied people enrolled in Medicaid. They would require all states to verify that Americans aged 19 to 64 who are receiving Medicaid-funded health coverage are spending 80 hours a month working, training for a job, studying, or volunteering. Jamila, what message does this send to the millions of Americans who are enrolled in this program?
Brittany, I call those reporting requirements. I don't call them work requirements because they're really not about work, right? The vast majority of people who are on Medicaid who are able to work are working. And those that are not working, even if they're technically, quote unquote, able-bodied, have good reason for not being able to work. They are caring for an ill parent. They're caring for children. They're going to school part-time. They're working part-time, but not working full-time. They're doing what they can. But these reporting requirements are going to end up disentitling people from Medicaid, whether they work or not. And from what we've seen thus far of states that have done this, like Arkansas and to some extent Georgia, they've made it difficult for people to report hours. And they've designed programs that people who are eligible in all the ways that the law outlines still end up losing benefits.
Coming up, the unspoken stigma behind the proposed Medicaid cuts.
The message is clear. We don't trust you. We don't believe you're deserving. And these folks are not fools. They pick up on that message loud and clear.
Stay with us.
Support for this podcast and the following message come from Delta, committed to the communities where their employees live, work, and serve. Delta First Officer Pilot Monique Grayson shares why she believes in the value of giving back.
Volunteering helps because it gives you an opportunity to see a different perspective. There's so much in the world that we'll miss. But when you take a moment to spend time with somebody else, to pour into somebody else, your perspective changes. You start to see the importance of being the change you want to see in the world. It helps people reach their goals when you have someone showing that they care. And when people feel cared for, they perform differently. Their confidence changes. This person is supporting me. And then not only that, it holds them accountable too. Because if the person that's supporting you is in a position where you want to be at, let me go ahead and put my best foot forward. At least that's how I would think about it.
Delta, committed to giving back for 100 years.
This message comes from U.S. Bank. As a small business owner, you're used to doing it all. But U.S. Bank Business Essentials is here to help. It's a powerful combination of checking and card payment processing that gets you fast access to the money you've earned with no monthly maintenance fee checking and unlimited digital transactions. They even have small business specialists that work together with you to help your business reach its full potential. That's the power of us. Deposit products are offered by U.S. Bank National Association, member FDIC.
I want to share something Speaker Mike Johnson recently said.
You don't want able-bodied workers on a program that is intended, for example, for single mothers with two small children who's just trying to make it. That's what Medicaid is for, not for 29-year-old males sitting on their couches playing video games. We're going to find those guys and we're going to send them back to work.
Joan, is this characterization of the type of worker they're looking to cut from Medicaid, this late 20s guy on the couch, is that guy reflective of a common type of Medicaid enrollee?
No, and Jamila spoke about this before. I mean, first of all, about 40 to 50%, depending on the state, of Medicaid enrollees are children. I want to say Medicaid is incredibly important to women. We've not heard a lot about women in this debate, but Medicaid pays for 40% of births and close to half of births in rural areas, who, by the way, are going to be even more impacted by these cuts.
Right, because Medicaid, I understand, it also helps to keep a lot of health facilities open.
That's right. We're hearing a lot about cuts to the Medicaid provider tax, which will hurt rural hospitals. We've seen lots of rural hospital closures, and already today, 52% of rural hospitals have no labor and delivery unit. So you can have the best private insurance in the world, but if you can't safely have a baby, those communities are not going to be able to grow and thrive.
Can I add one thing? Just thinking about this caricature of the 29-year-old dude who's sitting on his mother's couch.
Yeah.
The largest categories of Medicaid beneficiary are not reflected in that 29-year-old man. And there aren't enough of those people to make up the hundreds of billions of dollars we're cutting from Medicaid. But the second thing is maybe a little more controversial, but I'll say it anyway.
Okay.
That 29-year-old dude sitting on his mother's couch ought to have health care as well.
Say more about that.
Because now, instead of getting preventative care, because we want to punish him for not being sufficiently hardworking, he's not going to get that preventative care. He's going to go to the emergency room, and that's going to cost more. And if he can't pay, guess what? They still have to treat him. If he has a contagious disease and it's not getting treated, maybe that mother of two is getting that disease. Maybe her children are getting that disease. Maybe his mother is taking care of him, and now she has the burden of his health on her hands. We cannot punish that 29-year-old man by taking away his health insurance without punishing everyone.
Yeah, and I would just add to that by saying this is not where the money is going in Medicaid, even if we could find a few of those people.
Those 29-year-old males, right.
They're not very expensive because they're not using very much health care. Medicaid is the largest payer for long-term care for seniors and people with disabilities because Medicare does not cover that. So
wow.
That is where, the majority of Medicaid funds are going. So it's flipped now, the narrative, to the people are fraudulent, right? The people are not worthy, and we're going to go after them.
All of this kind of speaks to a belief that some in government seem to have about Medicaid. I think the point that you made, Joan, really walks right up to this. There's this idea that there are many people, many people who are enrolled in Medicaid who don't perhaps deserve to be on it. And this is something that we see across many social assistance programs, from welfare to SNAP and WIC benefits. I mean, but as we know, Medicaid is not a direct cash payment system. It's not a check. It's health insurance, which is a reframe that you all offered earlier in this conversation, Joan. It's something that many people would argue is a basic need and a service that is free and accessible in many countries comparable to the United States. How do stereotypes about undeserving beneficiaries of this health insurance affect the actual people who rely on this type of assistance?
Yeah, I love this opportunity to redirect towards the people being affected. People in community, your family. We're absorbing on a society-wide level these stereotypes, and it creates an environment of harm for the people who need to use these programs because they're made to feel like less than. And not because it's in their imagination, but because it's in the public discourse, right? And so when you say, we got to give you a requirement to make sure you're working before we give you these benefits, that is reinforcing the idea you can't be trusted. We're not making people report their work before they get their home interest loan mortgage reduction, right? When we're redistributing resources to middle class and upper middle class people, we're not making them jump through fire burning hoops, deal with burdens. Why? We trust them. We believe they're deserving. And the people who we make do these things, the people who are constantly under threat around a loss of resources, well, the message is clear. We don't trust you. We don't believe you're deserving. And these folks are not fools. They pick up on that message loud and clear. And what we find is when people have negative experiences where they're made to feel like burdens, when resources are taken away from them, and in the context of this kind of negative discourse about them, it actually causes people to become alienated from government, to engage government less. So it entrenches these kinds of processes even more. right? In the next round, we can take even more away from low-income people because they have even less political voice and power because we have created experiences for them that send them messages about them not belonging in our democracy.
Yeah, I would just add that when you're talking about healthcare specifically, and Jamila brought this point up earlier, but just to elaborate on it, first of all, your healthcare needs don't go away just because this bill is about to take away your health coverage, right? So you still have your healthcare needs. And a couple of things happen. First of all, they get worse if you don't get access to primary preventive care. You wind up in the ER. You're sicker. It's more expensive. And your costs get shifted to other payers in the system. And yes, Medicaid is a big program. It's sort of expensive from the federal budget perspective, but as a payer, it's a pretty lean program in our healthcare system. And yet it's being asked to absorb all of these cuts, not addressing any of the underlying challenges in our healthcare system.
Well, my gosh. This is a lot to process. And it's very vital and very important for the majority of Americans, as you both have laid out. And so I really appreciate you taking the time to go through this with me today. Thank you both.
Thank you for having us.
Yeah, thanks, Brittany.
That was Joan Alker, Executive Director and co-founder of the Georgetown Center for Children and Families, and Jamila Michener, Professor and author of Fragmented Democracy, Medicaid, Federalism, and Unequal Politics. And I'm going to put on my influencer hat for a second and ask you to please subscribe to this show on Spotify, Apple, or wherever you're listening. Click follow so you know the latest in culture while it's still hot. This episode of It's Been a Minute was produced by
Corey Antonio Rose.
This episode was edited by
Nina Patak.
Our supervising producer is
Barton Girdwood.
Our executive producer is
Verilyn Williams.
Our VP of programming is
Yolanda Sanguini.
All right. That's all for this episode of It's Been a Minute from NPR. I'm Brittany Luce. Talk soon.
Support for this podcast and the following message come from Delta, committed to the communities where their employees live, work, and serve. Delta First Officer Pilot Monique Grayson shares why she believes in the value of giving back.
Volunteering helps because it gives you an opportunity to see a different perspective. There's so much in the world that we'll miss. But when you take a moment to spend time with somebody else, to pour into somebody else, your perspective changes. You start to see the importance of being the change you want to see in the world. It helps people reach their goals when you have someone showing that they care. And when people feel cared for, they perform differently. Their confidence changes. This person is supporting me. And then not only that, it holds them accountable too. Because if the person that's supporting you is in a position where you want to be at, let me go ahead and put my best foot forward. At least that's how I would think about it.
Delta, committed to giving back for 100 years.